want to also talk about Medicare for a minute. In fact, I'll do Medicare first and then your other issues. In terms of the federal budget, Medicare is up here and everything else is down here. Other than the $600 billion plus that we spend on the military. And that's money that is spent based on threats and the like. This one, Medicare, is based on the fact that 10,000 people turn 65 every day and will for years and years to come. So if somebody shows up to talk about the federal budget and doesn't talk about Medicare, it is not on the level, folks. So I'm going to do that for a quick minute and then tell you. So back when I was director of the Great Panthers, some of the seniors might remember this, Medicare had two parts. There was Part A and Part B. Part A was like if you broke your ankle and you had to go into the hospital and they did some surgery on you. That was Part A. I see some people nodding in the front row. Part B was like if you got a really bad case of the flu. Really bad. It's been knocked out. You went into the doctor's office. That was called Part B of Medicare. A and B. That's what you had for years and years and years. That, folks, is not Medicare today. In fact, you would never see another television commercial about Medicare if it was about broken ankles and a bad case of the flu. Medicare today is about cancer, it's about diabetes, it's about chronic illnesses, heart disease, strokes. Now listen to this. That's 90% of the program, 2 or more of those conditions. And it hadn't gotten a lot of press, but Orrin Hatch and I wrote a bill the other day that says we're going to update the Medicare guarantee to start covering those areas. More care for people at home, more use of non-physician providers, more telemedicine. Somebody to coordinate care is my dream, because you can be a lawyer or an engineer, and you have 2 or more chronic conditions. Go out there and try to navigate the healthcare system. Good luck with that. So we're ending on a little bit of a positive news that in the middle of all this fighting. By the way, you know what the vote was in the Finance Committee on updating the chronic conditions part of Medicare? 26-0. Okay? Every Democrat, every Republican. Okay, here's how you make your voices heard. The first thing is coming to meetings like this, participating in marches, writing letters, speaking out. There's no substitute for that. I can't tell you, Nancy and I were just head over heels thrilled that so many Oregonians came back for the Women's March. Yeah. That was really, really inspiring. And I'll tell you, as long as I'm the senior Democrat on the Finance Committee, the federal government is not going to prohibit women from getting to see the doctor of their choice. Okay? So, speaking out, number 1. Number 2 might surprise you. If you think your senator or your congressperson is with you on a particular issue, whatever it might be, look at the news articles on the Congress people who haven't made up their mind. There are usually a lot of them, and we can tell you about them. And if there's somebody in another state who hasn't made up their mind, and you've got a great friend from your wedding, or you were a college roommate with them, or maybe you were a counselor over a summer camp kind of situation, call them up and say, your senator is going to be key here. Your senator doesn't care about what I think because I'm from Oregon. And you say to your friend, Clara, Beth, whatever her name might be, I've never called you before, ever, about politics. We've been friends in the summer camp or the dorm or get married, whatever it is. But this is a really big issue, and your person may decide it. So I decided to call you, and I hope you'll call them, because it's important for the values that I think we both shared. So I think that's the second one. A third one is supporting whistleblowers. Whistleblowers are so important. And they're your neighbors, your friends, they work in these government agencies. They can help tell us what's going on as well. And fourth, put in a little bit of time in some of the areas that you're reading about in the news so you can give us good reports on what's happening. I cannot tell you how strongly I oppose the cuts in the proposed budget in the cuts in the anti-hunger programs. I mean, so many of these programs. You know, I went to school on a basketball scholarship. I was dreaming of playing in the NBA. It's a ridiculous idea. I was too small, and I made up for it by being really slow. But in the summer, I go out to these programs, police athletic league, community programs. We got them all over the state. They're always called something different. And I shoot around with the kids, and they give them a lunch, and you just can see they're just starving. And so often I ask the kid, have you had anything to eat since yesterday when you were at the lunch? And they kind of look at their shoes, and it turns out they might have had a candy bar, but they're not getting much of anything. So we really need, as Oregonians, I don't care whether you're a Democrat or Republican or liberal or conservative, we've really got to fight to protect our food banks. I'm going to try to do it on the charitable laws. We got them expanded for farmers to make donations. I think it's really important as we get to the warm weather. You know when we need volunteers at the food banks? We need them during the warm weather, July and August, because I see it. You know, they always ask Nancy and I to come out during the Christmas holidays, and I'm glad to do it. They've got all the food boxes going out, and we're all feeling good, and everybody who's well off is buying gifts and stuff like that. But when they really need volunteers is the summer. The summer months is when Oregonians are at the beach and the mountains and the like. So we're really going to be out there this summer helping those programs. So because SNAP and those anti-hunger programs are really under the gun, that's another thing you can do, is to go out and visit them, tell us what kinds of things you're seeing so that I can use it, and your other members of the delegation can use it as well. Let me leave you with a thought.